In this video, I will be demonstrating how to perform a joint examination for rheumatoid arthritis. We will be focusing on RA, which is the most common form of autoimmune arthritis. However, many of these joint examination techniques are also applicable when assessing patients with other forms of inflammatory arthritis, such as psoriatic arthritis, reactive arthritis, or lupus. When assessing a patient with RA, you should examine each joint individually for tenderness and for swelling or synovitis. You can use a homunculus chart to help you keep track of the number and location of tender or swollen joints, which you can use later to help you calculate your patient's RA disease activity score. Performing a full 28 joint count exam might seem a bit daunting at first, but you will find that with practice, this exam can actually be performed in as little as 2 minutes. We will begin with the examination of the hand and wrist. Rheumatoid arthritis commonly causes synovitis of the wrist, the metacarpal phalangeal joints, or MCPs, and the proximal interphalangeal joints, or PIPs. When RA is active, these joints can become tender and swollen, and they will feel squishy or boggy when palpated. It is very important to distinguish this from the common findings of osteoarthritis in the hands. Osteoarthritis causes bony enlargement of the PIPs and the DIPs, and these OA joints will feel hard on exam, not squishy. To examine the MCPs, position the patient's fingers in slight flexion, then use your thumbs to palpate along the joint line, which is here. It's more distal than you might expect. In a normal MCP that is not swollen, you will feel a bony groove, which is the joint line. If there is synovitis in the joint, it will feel swollen and you will not be able to easily feel that bony groove. Synovitis in the small finger joints can feel a bit bouncy, like squeezing a ripe grape or pushing on a yoga mat. As you palpate each MCP in turn for synovitis, you should also remind the patient to tell you if any of the MCPs are tender. To examine the PIPs, you can use the interlocking C technique. You should position your fingers into 2 interlocking Cs. With one hand, you repeatedly squeeze the top and bottom of the joint. Meanwhile, with the other hand, you are going to feel for any bulging of the synovial tissue along the lateral edges of the joint line. If there is no synovitis in the PIP, the lateral joint line will feel firm and bony. However, if synovitis is present, the lateral edges of the joint line can feel squishy and bulging. You should palpate each PIP in turn, assessing for both swelling and for tenderness. The distal interphalangeal joints, or DIPs, are typically not involved in RA. Therefore, they are not included in the 28 joint count examination for RA disease activity. However, you may still wish to examine your patient's DIPs, in which case you can use the same technique as you did for the PIPs. If you discover that your patient does have DIP arthritis, this should raise your suspicion for forms of arthritis other than RA, specifically osteoarthritis, psoriatic arthritis, or gout. In a patient who has advanced or late-stage rheumatoid arthritis, you may see more severe deformities in the hands, including ulnar deviation of the fingers at the level of the MCPs, swan neck deformities of the fingers, or boutonniere deformity of the thumb. Depending on the patient, these deformities may be either fixed or reducible. Next, we will move on to the wrist. To examine the wrist, place your thumbs over the joint line and move them back and forth. In a normal wrist, you should feel your thumbs drop into a small divot over the joint line. If the wrist is swollen, you will feel fullness or bogginess at the joint line. Of course, you will also ask the patient about any tenderness as you palpate. To examine the elbow, first move the patient's elbow into partial flexion, then find the gap between the olecranon and the lateral epicondyle. This is where you will palpate for both tenderness and for swelling. Next, to examine the shoulder, grip the patient's shoulder with your hand. In this position, you will assess for tenderness under your thumb, and also feel for swelling under your thumb, which can feel like bulging or soft tissue thickening. You can also passively abduct the shoulder to about 50 degrees to see if this elicits tenderness. The knee is best examined with the patient lying supine on the exam table. palpate along the medial and the lateral joint lines to assess for tenderness. To assess for swelling, start with a visual inspection of the knee. If the knee is not swollen, you should see indentations or dimples on either side of the patella. If the knee is swollen, these indentations may disappear. You can also perform the bulge test to assess for a knee effusion. Swipe upward along the medial side of the knee in order to push any fluid up and over to the lateral side, then swipe downward along the lateral side of the knee, watching carefully to see if there is any bulge of fluid on the medial side. You can also perform the patellar tap test. Use one hand to compress the suprapatellar pouch and to move the fluid distally down under the patella. Then use your other hand to repeatedly tap on the patella. If there is a large effusion, the patella will appear to float and will prominently bounce back when you tap on it. The ankles and toes are not included as part of the 28 joint count exam that is used for calculating RA disease activity scores, such as the CDAI or the DAS-28. However, these joints can definitely be affected by RA, and if your patient is complaining of pain in their ankles or feet, you may wish to examine those joints as well. You can feel for swelling in the ankle by placing your fingers on either side of the extensor tendon and ballotting for an effusion. You can also look for the loss of definition around the medial and lateral malleoli. You can then passively test dorsiflexion, plantar flexion, inversion, and eversion to see if this elicits pain. Finally, a quick and easy screening test for MTP synovitis in patients with RA is called the MTP squeeze test. This test is positive if it elicits pain when you gently squeeze across the MTPs. With a bit of practice, you will be able to perform the RA joint examination quickly and consistently. A reliable joint exam for tenderness and synovitis is among the most important tools for assessing your patient's RA disease activity and guiding treatment recommendations.